The regulatory complexities, the payer complexities, it all is just kind of outside noise to them when those are very real barriers to entry to getting a product to market.
Welcome to Lifesci Continuum. Today I get to speak with Jack O'Callahan, Director of Business Development of Northeast Biomedical. Jack has 25 plus years in medical device sales and commercialization.
I think the other thing that is often forgotten in medical device development is that medicine is still more of an art than it is a science, right? We have all this information, but there's still things that every individual is different that a doctor has to address.
In this episode, we talk about how the healthcare system is not set up to let you and your device, therapy, or technology in. Even if your product truly helps people, even if it's a no-brainer, the system doesn't just say yes.
Total addressable market, TAM. It's $67 billion, and we're going to have half of it in 3 years.
We talk about how too many new companies assume that deep clinical knowledge translates into market success and what you can do to avoid this.
The key is really honestly admitting to yourself what you don't know. And once you admit that, then you can have a clearer picture. I think that the smartest people that we deal with here are the ones that say, well, you're the expert there. I'm not.
All right, let's go. So Jack, thanks for hopping on with me today. We've chatted a few times now, and it's great to have you as a guest on, so appreciate you.
Yeah, thanks for having me.
Tell me a little bit about your background for context for the audience. How did you get to the role you're in today?
I started out selling wine, of course, which is perfectly reasonable, right? But I got into, after I left wine sales, I started selling pharmaceuticals way back in the day when essentially all you were doing was buying doctors' business with lunches and tickets to games and all that kind of stuff. And I didn't really enjoy that. So that's when I found medical device sales, and I started selling needles and syringes, blood collection devices, and sharps containers, which is not very glamorous, but they're used all over a hospital. So I got to see all the things that went on in a hospital. And from there, I've sold a lot of different things, including, or sold and marketed, interventional cardiology products, enteral feeding products. And I've been in sales management, sales training, marketing management. I've been a VP of sales and marketing, and now recently, in the last couple of years, jumped over to the engineering services and become a director of product development, which is totally different, but in the same vein.
Talk to me a little bit about the type of work you do today in the space.
Yeah. So my job, it's interesting. For the 14 years that Northeast Biomedical's been in existence, our owner, Tim, did the business development. And what would happen was he'd go out and he'd get a couple of projects, and then he'd start working on the projects, and he'd stop doing the business development. So business kind of went up and down on a fairly regular basis. And it was fairly predictable when they were looking for projects versus when they had them. And interestingly enough, Tim and I went to middle school together, and we've known each other since the 7th grade. When he started the company, he told me, at some point, I'm going to need a sales guy. And a couple of years ago, he said, it's time, we're big enough. So I jumped in, and my job is just to find the customers, put them in the funnel, and then get them in front of our engineers when the time is right. When they're ready to start a project, I get them to our engineering team and then kind of manage the process of the proposal all the way through close and negotiation, and then hand it over to the engineering team.
Right. And what are some examples of projects that you've worked on in the space?
Since I've been here, we've had a number of different and interesting projects. One that we're consistently working on for one of our bigger customers is we build a reagent processing machine that processes goat blood, of all things, for use in lateral flow testing, which is like a COVID test. And we've worked on machine vision guided robots, catheters that deliver medication to the heart. So we're kind of all over the place in the medical device space.
Okay. So the reason we're talking today is you and I have talked quite a bit in the past about working with technical founders, very smart people. They might be from a clinical background or a technology background or engineering background. They're all really smart, and they go down this path of having an idea and developing something to bring to market. And they struggle. And that's why, they talk to people like you and I, and we have some very shared experiences, if you will. I think one of the points that you've made in our conversations is they're smart, but they underestimate the path ahead for them.
Yeah.
And that's what we're talking about today. So let's set that up and maybe provide a little bit of context around that. What are you seeing as
Yeah.
it relates to that?
So often, from so many different sources, we see these folks with these great ideas that are like, that could really improve the delivery of healthcare, or improve a surgical procedure. But like you said, I think the perfect term is underestimating the process. That good idea really means nothing until you have a plan. And so often we get physicians we call them physician inventors, that have this great idea, but they think because they're a physician, they went through 8 years of college, then all of a sudden, 8 years of college in medical school, I should say, that they think then they know how to run a business and they know how to get a product to market. And the regulatory complexities, the payer complexities, it all is just kind of outside noise to them, when those are very real barriers to entry to getting a product to market. And then so often we see the financial constraints that are just, folks just don't understand the huge amounts of money for a class 2 medical device to get to market. It's what, typically 100 million, is not an unreasonable number, right? So I think those are the two things that these founders just don't appreciate and don't realize, like, what the process looks like once they've gotten this great idea.
In speaking before, we look at it like you simply don't know what you don't know. And there's a little bit of a mentality of, we'll figure it out as we go.
We'll
We'll
build the
tackle
plane while
that.
we're flying.
Yeah, we'll tackle that down the road. And there are simply some things in some areas where it's not feasible, and you end up digging out, I think, later on down the road, and dealing with the sort of the blowback of not having a few things right out of the gate. I mean, it's pretty common.
It's
It
extremely
happens
common.
pretty regularly in this space. When I started out, I was surprised by my first go round or two, and then so many years later, I actually expect it. So why do you think that more technical founders kind of struggle with that?
I think it's potentially their ability to learn.
Quick interruption. I've got an offer for med device and life science companies doing at least $3 million a year, but dealing with growth challenges. The first step is really easy. Just connect with me on LinkedIn. The details are below. The rest is to follow. That's it. Let's get back to the podcast.
I think it's potentially their ability to learn, and they think, I can learn this quickly and I can absorb it and move right into the next step, where it's just not that easy, to manage the payer options and the payer difficulties is a scary thing. I think we talked about, when we spoke before, about when I was selling or marketing enteral feeding pumps, there were two types of disposables, that went into a pump. One was just a feeding bag and a single port. The other was a 2-bag system that delivered both food and water. And Medicaid wasn't willing to pay for the 2-bag system because it cost more. But the reality of the situation was that and this was probably 15 years ago, going from the costs that were causing nursing home patients to go from the nursing home to a hospital for just dehydration was close to $2 billion in just the US. And Medicare, Medicaid paying for these 2-bag systems probably could have eliminated 20 to 30 to 40% of that right away. And so, but when we presented that to the Medicare, Medicaid people, they said, no, you can just pour the water in the single bag system. And that was true 25 years ago, but the formulas have gotten so much more complex that all that would do was clog the system. and they didn't realize that. So, and this was back with a large medical device company that had most of the market share in enteral feeding, and they still couldn't get this through. So to think that, a physician inventor or an engineer with a great idea is going to be able to navigate that system without a lot of help and a lot of information, it's just not possible.
Yeah. So I think two key points to that. I think that one, um, the ability to learn pretty much anything can actually be a bit of a weakness here, because I think there's a vision that they'll simply tackle it all. There isn't
Yeah.
a problem that will come up that they can't solve.
Yeah.
But when it's one person, you know, or
Yep.
even two people, when it's a small team working, the problems, it's not that the problems are insurmountable. They can most likely be solved. Not all of them, but they can. And you have a finite amount of time and bandwidth, and you can only tackle a few things at a time. And so that extends the lifetime of bringing a product to market.
Yeah.
Who knows how long? And if you're doing this as a side project on the weekends out of your garage, it's like going to night school.
Right.
You'll get there, but it might take you 20 years.
Right.
So so I think that's one point. I think one of the other challenges too, is thinking that when you're developing a device, your customer, your buyer, is really your clinician, that you see yourself as. You are the customer, you are the market. And so when you solve a problem, when you address a need, the job for you is simply build it and they will come. I mean, obviously you've created a solution to this huge problem. And there's a whole dynamic there that I've actually talked about before, but really you're selling into a system. You're not selling to one individual. There's an entire healthcare ecosystem out there that's almost built to prevent everyone from bringing some kind of device into the market.
Yeah.
And so, with your point being that even an established large brand in the space with a lot of credibility, had a tough time bringing an obvious and needed solution to the market, strictly because of the obstacles, in the payee system.
Yeah. Yeah. It's interesting. I relate it often to back when I was a product manager. There were two types of sales reps, right? One was the one that would call me and say, if I had this device in a blue, I could sell 3 million of them. And you say, well, okay, but to get it in blue, it's going to take, X amount of dollars, X amount of time. And then there were sales reps that said, hey, I got a great idea from one of my physicians today. So I took it to 3 other physicians. They all said it's a good idea. They made some different iterations to what they were looking for. And if I had this device, I could grow my business by this many cases in each one of those hospitals. So it goes back. A lot of physicians think, well, if I want this, all my peers are going to want it. When the fact of the matter is, if you put 50 physicians in a room, they're not going to agree on 3 things, right? So it makes it kind of, it might be a good idea, but you really need to do your market research and see how many different techniques there are. Because I think the other thing that is often forgotten in medical device development is that medicine is still more of an art than it is a science, right? We have all this information, but there's still things that every individual is different that a doctor has to address. So they might see this set of the population and they might say, okay, this is great. But, there's also 4 other techniques that need to be taken into account. And that's where some of these inventors, it doesn't matter what their discipline, might forget, okay, I have a great idea. I can run with this great idea. You got to stop and take a bigger picture of the whole market and understand, what's done in other cases, not just in your case. Does that make sense?
Right. Yeah, absolutely. So, I think we all want to deliver better medicine.
Yeah.
And what we forget sometimes, or maybe even aren't aware of, is the kind of the lenses that we look at the world through. And for a person, it's super rare for somebody to go into their job, whatever it is, um, acknowledge and identify a problem that they're experiencing. Um, take the step from, well, I guess I just have to, just deal with that problem, and say, why are we dealing with that problem? We should fix that. Then make another leap to, wow, I could make this into a product, all the way through to actually getting something that you can commercialize and manufacture.
Yeah.
And then get through all of these gates to find KOL, so those early adopters who see it and recognize its potential and say yes.
Yeah.
And then you have the broad pool of maybe clinicians or technical people out there. Like, we all hate change, and we're really resistant. I think there may not be an understanding or appreciation of how big each of those steps is, and how the person, the inventor who gets to that sort of end outcome, is such a unique individual, where you see yourself as the customer still, but you're not the customer anymore.
Right. Right.
You're something else entirely.
It's almost like you're
so
the vessel for the idea, right? And you're trying to kind of gain passengers that can help keep this thing moving.
Yeah, I mean, you said market research, and it sent me down that path, because how many things have to line up for a person to walk through all those gates? How many
Yeah.
experiences, and where does your mind have to be? And because you did it, I mean, look at all the people who didn't do that. All the people who are just dealing with the problem, or just working around it, or whatever that looks like. So I think that's a really good point in doing the market research and understanding, there's a need, but is it a big enough need?
Yeah.
Is it something systems are willing to invest in solving?
Well, and then I think one of the favorite terms that is always thrown around in the investor circles, and when people are pitching for their funding, is that total addressable market. The total
TAM.
addressable market, TAM. It's right. It's $67 billion, and we're going to have half of it in 3 years. You may not, though. Probably not, right? And so
Yeah.
if you can say, I'm going to get 0.5% of that in 2 years, and from there we can iterate the device to be used here, 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 and here. But the hardest thing, I think, for these inventors is to stop and say, okay, there may be things I don't know here. And the best ones, the best innovators that we've worked with, in my observation, have been the ones that say, okay, here's what I don't know. Please explain that to me. And when they then seek out Northeast Biomedical or Mesh, right, that to say, I don't know how I'm going to attack this market. I don't know how I'm going to do this. I don't know how to build an engineering plan. And then they start to figure out who the smart people are that can do that around them. That's when these ideas really start to take shape and take movement. That's where you have to address that financial piece, right? And there is a financial component to all of this, but it's like when you, if someone that doesn't know how to fix a car tries to fix a car, they're going to end up at the mechanics paying more than they would have if they just let the mechanic do it. So, don't fix it. Let someone that knows how to fix it.
A mechanic does this all day, every day. They can pop in and in an hour just get it done. They have the tools, they have the methods, they have the experiences of and understanding of it never goes how you think it's going to go.
Right.
I think when we're excited about our product idea and we're moving, and it's, certainly those early non-completely exhausted days, we sort of look at these with rose-colored glasses and think, oh, well, all these things, I'm just going to knock them down. Everything's going to go perfectly. But think about literally anything that you experience during the day. What is one thing that actually goes perfectly?
Right.
And this system is set up to kind of clear out those things that are not done perfectly.
Yeah.
And like you said, even when everything's, lined up and perfectly, sometimes the system is just like, nope.
Well, and then you walk into your first animal study and you say, wow, this is great. But if we could do this, we could make it turn left as well, make that catheter more steerable to the left or to up or down. Then you might have to go back and iterate. And you still had it right. You just didn't have it completely right. And you have to learn as you go. And so there's definitely a patience and a kind of willingness to kind of just grind, right? This is not a simple process, like you said, of just, no, I'll just walk through. Somebody will give me $100 million to finance this whole operation, and off we'll go. And sales tells you, okay, we're going to sell all these. We're going to have our forecast is a hockey stick. Yep. Okay. I don't know if it's going to be that good, but let's hope, and then
Right.
you find out it's not as easy to get every doctor on board. And, what's the strategy to get in front of the right customer, and how are you going to convince them? Is it going to be key opinion leaders? Is it going to be, local key opinion leaders or local experts that can then bring everybody together? One of the things we did when I was selling marketing home hemodialysis was we had dinners where the physicians came, the physicians that were doing home hemodialysis, they would do an educational piece for 10 doctors in the area, and then they'd have a chance to talk. It was the best marketing we can do, and it wasn't doing anything terribly creative other than educating, and then having the docs talk about how it's done and how they can make it part of not only their clinical practice, but their business too. So they were able to see the benefits from someone other than the guy selling it.
We really like those environments because we can get really good voice of the customer.
Yeah.
Because if we've learned anything over the years, it's that a thousand different clinicians will look at the same problem 1,000 different ways.
Yeah.
It's very nuanced, and so getting sort of that broader sense of how the market is seeing and addressing a problem can be powerful, both from developing whatever that end solution is, but also positioning it and talking about that problem when you go to do communications or marketing or things like websites. You started talking about TAM, and we sort of always see that number as, wow, that's such a big market and such an opportunity, but it's an opportunity. And that number doesn't reflect the reality of getting through it. And you talked about a hockey stick. You had said something the other day about it being more akin to winning the lottery,
Yes.
versus going through a step-by-step guaranteed input-output engineering kind of process. It's really more about, you do all of these things almost like buying a lottery ticket.
Right.
Can you talk about that a little bit?
Yeah, I think the key is to address the addressable part of the total addressable market, if that makes sense, right? And it's to define that. And that's where there are experts in the marketplace that can help you. Like a lot of what you do is getting to that right ultimate customer that will help you establish that this is a good clinical practice that has a good outcome, that then you can grow that. And if you can build an expectation around that plan rather than just assuming acceptance, right? You're going to be able to grow ultimately significantly faster, but in bigger chunks. And once you get into the market and you start to see some revenue coming in, then you start to get the learnings of, oh, well, this works and this doesn't work, or this is a better technique to use with that surgical instrument. And once you have that anecdotal evidence, then you can start to build much more of a story. And that's what I think, when you have the idea, if you're the inventor, when you have the idea, you think, well, of course, it's obvious. It's so right. Often it's a crutch that happens in sales too, where, well, my product's clearly the best, and the sales rep feels that. But you have to convince someone else of that, and you have to find a way to make them understand that you're addressing their problem. And the best sales reps are the ones that address the underlying issue and fills the need. Same thing here. You find out what the need is, and then you expand that need set to then address those needs with your product. And boy, that's hard for someone that invented the product to do, because in their mind, I figured this whole thing out, and it's very logical to me, but you got to make it logical to everybody, right?
There are plenty of situations where founders just simply get it wrong. They're misreading the reality of the situation, and sort of call this magical thinking.
Yeah. Yeah.
And where everything goes exactly perfectly right. You had a really interesting example um, around Department of Defense, so
Yeah.
DoD. You want to tell me a little bit about that story and maybe the problem there and why it's a problem?
We we do a lot of mentoring over at M2D2 at UMass Lowell, and we were one day watching people or helping people prepare their pitch presentations. And one inventor was planning to sell a product to the DoD, a field medical type product, and it was a pretty good idea. And so he said to him, "Well, what's your access? How are you going to get through to the DoD?" He said, "Well, I just need to find the right person." And we kind of all the mentors in the room looked at him and said, "Well, where does that person work? Who does that person? What department is that? Where are you going to go?" "Oh no, I just have to find them. I'm not sure who it is. I just have to find them." And so it's like, well, okay, yeah, but that's not, there are 100,000 people trying to find that one person. And if you can find that formula, great, then you should sell that rather than this product, because the product's going to be limited. You're not, and we tried to make him understand that that's not a great strategy. You have to know the process of getting to the DoD. And there are people in the world that know how to do that. And then you have to find and engage that person so they can help you find the channel to get in there, rather than you just making phone calls to every DoD employee, because that's just not going to work. And that I think that falls back to, this inventor feels like they have this great idea and they're all excited about their idea. And so that magical thinking of, well, it's all going to line up. Once I find that person, then, they'll start writing me checks and I'll just be able to go and play golf. And it's just not going to work that way.
Yeah, I think you could play Mad Libs and start with, I just need to
Yeah.
blank, and whatever you're putting in a blank, it's sort of getting discounted. It's sort of getting diluted into this magical thinking, and that, oh, it's just a simple thing. We just need to do that, and everything will go perfectly. But it's never that easy,
No.
and these things take time. They sometimes take a specialist to really get in there and crack the nut. Some of these just magical thinking scenarios are really, really quite complex.
We
And
use the term doctoritis. I think we mentioned it before, where
yeah,
a lot of physicians think they have this great idea, they're going to get it to market, and then they're going to, in addition to practicing 40 hours of medicine a week, they're going to run this company. There aren't a lot of people that can do 2 full-time jobs in the world. And
right.
that's that magical thinking that, well, it won't be that hard to run a medical device company. I just have to hire a couple of sales guys, the marketing department, and somebody to manufacture. We're done. Well, no, there's a whole, slew of things that you need to have someone that knows how to access payers and all the different things that commercialize a device, not only build it, but commercialize it too, right?
Yep. And again, it sort of assumes that everything is going to line up and go perfectly. And we know, time and time again, you take a device out of the engineering, the manufacturing department, and you get it into the OR.
Yeah.
Right out of the gate. There's a quote that is everybody has a plan until they get punched in the face. It's when it becomes a reality, all of these things pop up that just were never considered. And it's not a failing of the person. It's not because the person wasn't intelligent or couldn't learn it. But it's kind of a lived experience. There's something that we all gain from 20 years, sometimes 30 years, in practice. We've seen it before and we know to anticipate it, but as much as we've seen, we still can't there's so many new things we can't anticipate. Wi-Fi and AI and all these things happening now. It's every maybe 10 years it's the Wild West again, because some big new thing is out there, and now we can apply the things before and ask questions but we still need to spend the time and bring that expertise to the table. So
Right.
it's tough for any one person to do all of 17 different jobs that are required. And think about that we're bringing a medical device that we're going to put into or use on, a human. That the bar there is so much higher than so many other industries.
A book, right? They don't read the book. They
Right.
don't read the book, right? If this goes in and it's wrong, you could grandma could pass, right? And we don't want that.
Exactly. So, we've talked a little bit about the idea of not waiting until you've spent months trying to figure out something that if you'd had help with, on day one or day two, you're just stuck in it. And now you've got to dig out of that and also go back and unwind a whole bunch of the clock.
Yeah.
What are some thoughts you have about, what types of expertise do you recommend that founders bring in early? What are some key things that they have to do early?
Yeah. So there's a number. I think number one is to understand your patent landscape and what type of patents are around the device and the technique that you're looking at. And then I think the next most important step is to really try to understand all the different pathways that are required to get a product to market. And that's not just being able to build it and manufacture it and engineer it, but it's also a payer strategy, a reimbursement strategy, a regulatory strategy. There's all these different types of pathways that all have to be addressed. And, I was thinking about this while we were talking. If you think about like a small to mid-sized medical device company, they all have a department to do those things. And these inventors are thinking, I can do this myself. Well, there's your answer, right? If a small company has, 30 people working on this and you're one person, do the math. It's just not going to work. So I think the most important thing, I think, is for that inventor to identify the things they don't know, and then to find the right help to advance those pieces, because you're a subject matter expert on the invention, the idea, probably the disease state, but there's all these other things that you really probably don't even know that you don't know. And it's a matter of defining those things and building a plan around that. And that's where companies like ours and yours and some of these the folks that help with payer strategy can be so helpful, because they can say, this is the most efficient way to do this to get you to a market and get you to a funding or whatever it is. But it's identifying the things you don't know before you even try to dig in, because there's so many things you don't know.
You said something there that I just don't often think about, but I think is really important. The idea here that if it takes you 50 years because you're doing it yourself to bring a product to market, because you can do all the jobs, but you have to do them at, linearly,
Yeah.
because you can't really do 2 or 3 jobs at one time. You have to focus and learn the expertise and understand the case studies and everything, and then do the job. And so you do that sequentially. And it's going to take time. It's going to take a long time. If it takes you 50 years, and I'm being hyperbolic, but if it takes you that amount of time, somebody else has come to market faster.
Yep.
People think they're the only ones out there trying to solve a problem. But if you recognize this is a problem and you're trying to solve for it, someone else out there, you're almost guaranteed somebody is doing that. And one of the benefits of bringing in someone to help you, not shortcut the process, but make it more efficient, avoid the pitfalls and the things that can set you back and hold you back. You can experience those, you can overcome them, but every one of those things pushes out your timeline when you're doing it alone. And I think in the spirit of saving money, I don't want to spend the money on the expertise. There's going to be a cost to you somewhere, and typically it's time and you can never buy that time back.
And how valuable is your time? It's if you're smart enough to have invented a medical device, you're smart. You have time. Your time has value. You're doing something that is meaningful. So that time, the time value of money is a true statement. And then the other piece of it is that like you said, you're never going to be able to do it all anyway. Even if you knew how to do it all, you don't have that time and bandwidth. We have a joke around here at Northeast Biomedical. There's 168 hours in a week, and we only want half of them. And but there's something to be realized there, in that there's only so much time that we have. So let's find a way. And yeah, the other piece of it is I'm trying to save $5,000 here, but you're spending $100 million to get to market. It's a fact. So, another 10 that's invested properly is going to get you that return faster. And so it's an important step to remember, because we do see, like I can't tell you how often we see a physician that wants a prototype that can go, so they can go show investors. Well, okay, what's your exit strategy? Are you trying to sell it, or are you trying to bring it to market? Well, what do you mean? And all of a sudden it's like, there's two different strategies there, and there's a give and take to all of it. And so the expertise that I think folks like us offer is of such value that, you'd hope someone would think, I'd be crazy not to engage these people, right?
Yeah. And I think that's one of the frustrating experiences that founders have. You touched a little bit on talking to investors. There are different types of investors out there.
Yep.
They look for different types of products or therapies or solutions, and understanding where you want to go with the technology is almost more important to them than the tech itself.
Yeah.
What's your model? Are you looking to build go IPO, or be private, or sell this thing off to the biggest brand out there?
Right.
A lot of these things that you're just not thinking about. You're just like, it comes back to, we'll figure it out when we get there. Well, investors really want to know that you have some vision.
You have a picture of there. Right?
Yeah, like, where are we going? Like, yeah. Okay, you have a map, but it's all folded up, and you only have the little piece of it. Sorry, I'm going back to old tech, but
yeah, right?
An old fold up. But I've only opened it up to the neighborhood around my house. Yeah. Where are we going?
Right.
You just want $10 million, right? Yeah. And you really just have the first step.
Yeah, and how quickly $10 million is gone, in the process,
so
right?
Fast.
And it's just amazing. It's even mind-boggling when you deal with it on a daily basis, to think we get the statement that I just want a prototype. Okay. But generally those right. prototypes, if you want it, documented properly, researched properly, you're looking at $200,000. Oh, well, I have 12. What can I get for 12? We can glue something together for you, but you can't, an investor's not going to want to look at that. Right.
I just need fill in the blank. I had an international client, and I run into this a lot because I work with a lot of companies outside of the US that come in to the US market. And it is, I hate being it, but it's necessary. I'm that cold pail of water to the face, because they'll come in and they'll say, okay, I see everything that you have here, and I want to do all of this. And what do you think our budget should be? And I say, what do you have allocated to enter the US market? We're a bit more complicated than, your hometown.
Yep.
And they say, well, our TAM is, billions of dollars, and this and that and the other thing. And we've allocated $7,000 to a US market launch. Like, I have to tap the camera and the micro, like, was that a typo? I maybe our currency exchange isn't quite up to date.
Yeah.
But there's not. That's what you get when you have that magical, I just need blank.
Yep.
Well, that blank is a lot, it's time, whether somebody else has spent the time to get the expertise to get there. It's you spending the time, it's money. The I just need, it very, very rarely pans out as quickly and
Yeah.
easily and cheaply as people
From
think it is.
just from the international market, you often get that. I just need a distributor. Okay.
Right. Right.
So you just need someone
Just
that
pick up
goes
the
in,
phone.
walk into a hospital with 700 other products, and they're going to sell
Yep.
yours because, and they
Yes.
think, well, no, I just need someone to sell it. Oh, okay. It is a struggle. It can be, but to have
If you
then
think about,
the correct marketing that goes behind it, and you can then explain to a distributor rep the value in them going out and explaining the value, then all of a sudden you're selling this thing, right? And but that's not linear enough. That's not the straight line enough. I just need someone to sell it.
I just need to get there. As soon as
Yeah.
they see it, they're going to love it and buy it. It's going to fly off the shelves. Build it and they will come. For people listening to this, imagining this, you have to think about how busy you are.
Yeah.
How much noise you have in your life, how busy you are with your regular job, after school, with kids on the weekends, how busy your phone is and how many just alerts you have coming through.
Right.
And now put yourself on the other side. Whatever that is that you just need is one event in all of those other things happening, that you're just trying to cut through.
Yeah.
And so it's really, really important to nail down exactly what expertise you need when.
Right.
Because you just don't need all of it right up front, but you can't wait until you reach the gate to call in someone to help get you through the gate, because at that point you're probably 2 steps behind and you've got to take a few steps back.
You're going to have to go refix the car, right?
Exactly. Because with, especially with devices and therapies, maybe focus on devices, but decisions you make in the very early days have implications all the way through to exit.
Yeah.
And just really understanding those, just getting a basic understanding is key. If you, so we're wrapping up here, some practical advice.
Yeah.
So increasing your odds of success along the way. I think we've talked a lot about bringing in experts, right?
Yep.
So what do you think are a few things that founders can do to sort of, stack the odds in their favor?
Sure. One of the things, and definitely from an engineering perspective, but also from a marketing and sales and commercialization perspective, is understanding the user needs is probably the paramount, because the user needs document in engineering is what kind of everything kind of grows from. And then understanding the user needs and why they would need it from a commercialization standpoint are 2 things that are going to direct a lot of what you're going to do. So from there, you can understand a payer reimbursement strategy. You can understand what type of devices is going to be. Is it class 1, 2, or 3? It's going to help you understand your regulatory requirements as far as is it a 510K? Is it de novo? All the different, and then taking the time to educate yourself enough to know, okay, this is where I'm going to need help, and understand kind of the it's not linear, obviously, but the flow of the process. And I think if you have that understanding at the beginning, you have a much better chance of being able to say, okay, now that we've submitted for the 510K, these are the next 5 things I need to work on. Or now that I have a prototype and I need to go while I'm having that prototype built, I need to seek out the investors that I'm going to, attract to talk about my device, so that then I can go on to the regulatory pathway. Have a good understanding of where you plan to exit this business. Is it going to be that you take this thing all the way through commercialization, or are you going to go find Medtronic or J&J and you're going to say, hey, you buy this? And that adds another layer of, well, who am I going to talk to there? It's not just one person at J&J that's going to say, sure, we'll buy that. And so you have to understand that landscape. So it's kind of continually identifying the things you don't know, and either determining that you can gain the expertise or finding the expert to get you to the next step. And that would be the things that's where I would tell people to start.
Right. And you just reminded me when you mentioned engineering documents. I worked with a company where at one point in their journey, the founder had, again, in his garage, put together a few, I think he had a competitor product and he pulled some pieces off and he plugged in a couple of connectors and this, that, like he really Frankenstein this thing. And then he just took that and handed it to an engineering, it's kind of like a contract company and he said, well, now make me a prototype of this. And they were like, it actually isn't going to work because, I think you had said one time to me, like, we have to work within like the laws of physics.
Yep.
And you're actually, the thing that you cobbled together doesn't actually work. Like you've shown us what you want it to look like, but your tolerances aren't factored in. The tubing you used isn't going to allow those liquids to flow through it. This is going to kink and all these things.
Those materials aren't compatible with these materials, and
right.
Yeah,
right.
I've heard in the last 3 years, I've heard our owner Tim Looney say we have to obey the laws of physics when we build this, and
right.
It's 2 of the 3 times I think the customer, the potential customer, debated that with him. So, again, the idea is a good one, but I'd like to be able to fly home today. It's not going to happen, right?
Exactly. Or what was it from Iron Man? Tony Stark built this in a cave with a pile of scraps.
Right.
Like that's a comic book movie. I mean, it's, we all, the rest of us have to work in the real world. We have constraints.
Yeah.
Things take time and money, and also that doesn't work that way. So that's a great one. Any other thoughts you want to share with the audience before we wrap up today?
No, I think we talked about all the things that we discussed, and I think the key is really honestly admitting to yourself what you don't know. And once you admit that, then you can have a clearer picture. I think the smartest people that we deal with here are the ones that say, well, you're the expert there. I'm not. So you tell me how it has to work and help me understand. And then once you develop that relationship, it's a really cool, like, building of the relationship, because then you're not working against each other, you're working with each other. And, using what you do as a perfect example, these folks probably have a clear idea of what their message should be. And you can take the idea of the message and make it usable. And once they get on board with that, then, like, they see that there's a guided vision to what they do. And then they start to say, okay, yeah, I get that. Let's try this. Or is there something here so then it becomes a collaborative relationship that really starts a ball rolling and starts moving forward. Does that make sense?
Yeah, 100%. I think that there's absolutely, almost orders of magnitude of how fast, efficiently you can go and grow and really get, expand the thing that you want to do, which is grow a business and create solutions, because it often isn't somebody who, they start with one idea, one solution, but the bug bites them and now they want to do other things. It's addicting. And when you're doing everything yourself and it's this kind of linear, long 20 or 30 year cycle. I was talking to somebody the other day who is brute forcing everything, himself. And he's frustrated because the market hasn't adopted his solution yet, but he's not halfway through the process, where if he had, 15 years ago, engaged, like you've talked about, the professionals at the right point, he would probably be done now.
Yeah.
But when you have that kind of collaboration and you have a kind of I would say the right team around you, right, to support you working at your level on these other things, so you can focus on the things you want to and only you can do.
Yeah.
Again, orders of magnitude of what you can accomplish when you don't have to do everything yourself over a 20-year period.
And I have one more thought, and this all works in reverse as well. We often get the question while we're going through like the proposal process and kind of trying to understand what the customer wants and needs. We often get the question, well, how much experience do you have in doing this? We sometimes have to say we don't have any, but we understand engineering. You understand the subject, and we're not going to just have you throw all this stuff at all this information at us and run with this. You're our subject matter expert. So once they become part of the team, and then you're part of that team together, then it's a like a symbiotic kind of energy that keeps growing, and that's where you start to get. Or in our business, we're always saying we're not looking for the first engagement. We're looking for the next project and the next project, and we want to start that relationship so that here we have this great expert in catheters. Now we can do 10 more things with them as they start to grow their excitement.
Yeah, exactly. And we could just keep going because there's an end. One last gotcha that we'll just drop in there at the end, and then we won't talk about it at all, is your version 1.0 of a product is almost never the product that ends up being kind of the final, commercial exit, the success. It's usually 2.0, 3. It's somewhere down the road when you've gotten it into the hands of the actual users, patients, whoever, and that's where you start getting a lot of that voice of the customer that gives you the feedback on they use it differently. We could make this better. They're not using it the way we thought they would at all, and we need to change this entirely. There's a lot of that happens. So taking so much time on version 1.0 to launch, it's actually quite brutal.
Don't let perfection get in the way of progress, right?
Yeah, and when you're doing it all yourself, it's just so long until you get to that point. So all right, Jack, thank you so much. I know we ran a little bit over, but I appreciate it. You were great today. Thank you.
I really enjoyed it, and we'll try to get Tim, and I'm sure Tim would love to add his engineering expertise to a discussion like this as well.
Would love to have him in. So we'll drop some contact details for you below the video. Thank you again.
Great.
Good talking to you.
Have a good day.
If you made it here, thank you. If you haven't already, like, share, and subscribe to the channel. If you want to learn more about this topic, I expand on it below, as well as in my LinkedIn newsletter. That's all for now. More soon.